Uh, Here we go. Of the Yolo Animal Services Planning Agency for Thursday, June 30th at 2 p.m. And can we do a roll call?
Yes. Member Carson?
Carson present.
Member Cowan?
Here.
Member Landsberg?
Here.
Member Provenza?
Here.
Okay, we have 4 members present.
And Mayor Vega is joining now as well.
Okay, welcome. All right, first we'll do the 361 notification. We're conducting this meeting via Zoom per Assembly Bill 361, authorizing us to hold the meeting via teleconference and to make public meetings accessible telephonically. And if you're in the public and you wish to comment, you can use the raise your hand icon at the appropriate time. Or if you're on phone connection, you can use the *9 to indicate a desire to make a comment. And we'll call on your name or by phone number at the appropriate time. And speakers will be limited to 2 minutes. Okay. The first item we have is to consider approval of the agenda.
I'm happy to move approval of the agenda.
Seconded
by
Vega.
Okay, I see a motion by Member Carson and a second by Member Vega, and we'll do a roll call vote, please.
Member Carson?
Carson, aye.
Member Cowan?
Aye.
Member Vega? Aye. Member Provenza?
Aye.
Motion passes.
Okay. Next up, item 3 is authorizing the continuance of the remote meetings pursuant to Assembly Bill 361.
So moved.
Provenza seconds.
Okay, we have a motion by Member Carson and a second by Member Provenza. Roll call vote, please.
Member Carson?
Carson, aye.
Member Cowan?
Aye.
Member Vega? Aye. Member Provenza?
Aye.
Motion passed unanimously.
Okay, thank you. Next up is to receive and file the May 26th meeting minutes, which were an attachment to the agenda. Was there any changes for the minutes? Is everybody okay with the minutes as they are?
Good.
Okay, seeing no objections, do we need to do a vote on the minutes?
I think it's usually best that a body adopt the minutes by.
Okay. Okay,
Provenza moves approval.
Vega seconds.
okay. Motion by Member Provenza and second by Member Vega. Roll call vote, please.
Member Carson?
Carson, aye.
Member Cowan?
Aye.
Member Vega? Aye. Member Provenza?
Aye.
Motion passes unanimously.
Okay, moving along, we have public comment. This is an opportunity for members of the public to address the Yolo Animal Services Planning Agency on subjects related to our business and not otherwise on the agenda. Do we have anybody wishing to speak for public comment?
Yes, it looks like we have one member of the public, Julie Sontag.
Okay, welcome, Julie. She's still muted.
Not sure, it says connecting to audio.
Yes, my error message showed that she might have an older version of Zoom that might not be compatible.
Oh, she's
Oh,
said in chat she couldn't get the audio.
okay. All right, well, have to try another way. Okay, was there any other public comment?
I was going to ask, is there a phone number she could call in on?
Yeah, that could work.
Yes, that phone number is area code 669-900-6833. Meeting ID is 851-0067-8146. We can also put that in the chat.
Okay. All right, well, if she pops up in a bit, maybe we can go ahead and let her speak a little bit later. All right, we'll move on to receive the panelist presentations and conduct a discussion session with Yolo County Animal Shelter Welfare Partners.
I apologize, Mayor Cowan. We've got one additional hand raised, Lisa Gaines.
Oh, okay. Welcome, Lisa.
Why didn't you guys miss me if I didn't show up?
Well, I was sure we would hear from you with the presentations.
Thank you. Thank you again, Joanne, for arranging the presentations. And I had a question just for the committee. Unleashing the Possibilities wanted to know, they would like to post some of the information from the JPA on the website so that we can create some public awareness. But we wanted to make sure that I didn't feel it was appropriate to put up everything, but I thought it was okay, if it's all right with all of you, to put up the goals that you guys have once they're finalized, and share that information, and maybe just our strategy and moving forward. Wanted to make sure that you were all comfortable with that, or if you wanted me to work with Joanne on that, or how you guys felt, because we think that it's a good way to just encourage public support.
I would agree with that. Is there any problem with them doing that? Eric, do you know if there's any issue with that?
No, I don't think that's a problem at all.
Okay.
I think it's up to staff to, see how they can manage their resources.
Okay, Joanne, I'll maybe lay it out, and then I'll work with you to do that. And then, just general information as we talk to Dr. Hurley and get information from other specialists. We'd like to share that with the community, just because we think it's a good way to engender more public support. So I will continue to work with Joanne.
Okay, thank you.
Okay.
All right. Go ahead. So are we ready to start the presentations then?
Yes, I'll give a brief
Okay.
introduction. So my name is Joanne Van Hoosier. I'm a management analyst with Yolo County Administrator's Office. And members of the JPA, I'm pleased to present today's panelists for our discussion on animal sheltering and welfare. Apparently, I'm going to come up with a new word, weltering. So of course, it'd be impossible to include every partner in a single conversation, but we're just so grateful to have the partners that have joined us today. We have Dr. Kate Hurley, Program Director of the UC Davis Correct Shelter Medicine Program, as well as Dr. Stacy Krause. She's Chief of Veterinary Service for Yolo County Animal Services through contract with UC Davis. We have Kim Kinney, the Executive Director of the Yolo County SPCA. And we also have from the Yolo County Spay and Neuter Group, Amanda Hartman and John Ramming. So just an absolutely wonderful group of folks with us today. And just to give you the structure of today, what we're going to do is have each individual speaker speak for 5 to 8 minutes on their organization and any opportunities they see for further growing the partnership with Yolo County Animal Services. We'll then have a few minutes opportunity for any immediate questions with the JPA members, and then we'll move to the next speaker. So we'll need to change speakers about every 12 minutes to make sure that we can hear from everybody. At 3 p.m., we'll pause for public comment, and then we'll continue on with any further discussion after that until the end of the session at 3:30. Does anybody have any questions before we get started? Well, I'm so pleased to turn it over to Dr. Kate Hurley first. Thank you so much for joining us, Dr. Hurley.
Thank you. It's good to see or meet everybody here. I'm the director of the UC Davis Correct Shelter Medicine Program. We were founded a little over 20 years ago as the first program of our kind in the whole world. So we have worked nationally and internationally in developing the field of shelter medicine and consulting with animal shelters, sort of at a referral level. We think about, just like in very brief, we think about shelter medicine sort of in parallel with production medicine on the on the livestock and farm animal side of veterinary medicine, where our role is not just to support shelters and keeping the animals healthy, but also realizing the goals of the organization. So we think of our products, if you will, as resolving animals' issues in the community, keeping the public safe, keeping animals safe from cruelty and neglect, reuniting lost pets with their owners, rehoming animals that are in need of new homes, limiting euthanasia, and serving the overall goals of the communities, ideally in the long run by keeping more animals safe in their homes in the first place. So that's sort of our very big picture of what shelter medicine is. We are a soft money program. So there's no line item in the UC budget for our program. So we're dependent on grants, donations, and a little bit of revenue for our operations. And then, as you may have heard, just this past year, the legislature approved a $50 million program for us to provide direct support to California shelters in the form of both training and consulting and grants. That is especially earmarked for our most vulnerable communities in California, some of the most underserved areas. And it's because it's a one-time investment. The goal is to see new programs develop that have the potential to provide an ongoing benefit. For instance, finding a way to lower intake on an ongoing basis so that it lowers the operating costs of the shelter and provides potentially a sustainable way to continue a program like that. I'm going to let Dr. Krause speak to the big collaboration that we have with Yolo County Animal Services to provide veterinary medicine. And I just want to say also, I speak only for the Correct Shelter Medicine program, not for the vet school and not for UC Davis. And there's many other potentials for collaboration that exist with all of those entities. So I don't want to sort of oversell what I'm allowed to say. Really where we have been so successful is allowing Yolo County Animal Services to be a living laboratory for some of the changes that that we're proposing, that we're researching, that we're developing. A good example is, I don't know if you've been there, you've seen the cat housing that was all improved through a grant that we received to research the effect of improved cat housing on feline upper respiratory infection. And that has dropped the disease rates dramatically at Yolo County, dropped the amount of time needed for care, and dropped the costs that can be then reallocated to other things there. And also what we learned there has been of benefit to tens of thousands, hundreds of thousands of cats across the world. And so we always look forward to opportunities to partner with Yolo County Animal Services in terms of like trying things out, cutting edge programs that might have benefit here and well beyond here. So, and for the shelter as well, right? They got about a bunch of free housing and some other benefits of that, as well as better care for the animals that came out the other side of that. And really appreciate the positive relationship that we've had with Vicki Fletcher in the past, and that we have with Stephanie Amato, and the willingness that there is, the transparency in terms of being able to partner. And this is Baldwin Park, my cat that was adopted from the Baldwin Park Animal Shelter in Los Angeles. He's making an appearance. So does that raise questions?
Mayor Cowan, you're muted if you were talking.
I'm sorry. Any questions for Kate? Okay, I think we can move on.
Oh, I see
Thank you.
questions,
See a couple of
hands
raised
raised
hands.
from Mr. Carson.
Oh, okay. Go ahead, Dan.
Thank you. Doctor, are there written or legislative statutory criteria for the allocation of that 50 million?
Yeah, there's trailer bill language that defines the criteria for it. And that's where the general preference for or a priority for underserved communities and investment in one-time changes that can provide an ongoing benefit. There's some other sort of preferences written into that Obviously, the goal of that $50 million was to realize California's policy that no healthy or treatable animal be euthanized. So funding would be linked to that outcome, trying to decrease the number of animals euthanized and improve the number of animals released alive, or decrease the number of animals admitted, which has the same benefit. And I'm happy to share the trailer bill language with you all if you'd like to see it.
Probably more clearly, why are we not an underserved community?
There's criteria that California has developed, or the social vulnerability index that sort of defines the level of vulnerability in communities. But I want to make clear that Yolo County Animal Services is certainly able to apply for grants under the California for All Animals program. And we've been in discussion with Stephanie Amato about possibilities. So it's certainly not, I got some feedback that there was an impression that maybe Yolo County couldn't qualify for a grant. That's not the case.
So if there's objective, I'm glad to hear that you're using an objective index to determine who's qualified and who isn't. And so I would just ask if you could share, there's obviously then some cutoff point. 50 million sounds like a lot of money, but I'm sure in a state the size of California, it only goes so far. But if there's a cutoff in your scoring, I would like to know what that is, and I would like to know what the score for Yolo County would be.
There's nothing that cut and dry in terms of the funding priorities. So one of the stated priorities was that there be a focus on our most socially vulnerable communities. One of the priorities is that we focus on the areas where the most euthanasia is happening. And in that sense, Yolo County is a victim of its own success. You're doing well, relatively speaking. But that's not to say, all the same, because of the proximity, because of our ability to learn and leverage what we learn here for the benefit of other shelters in the state and the nation, that we wouldn't consider funding for a program that would offer us an opportunity to learn up close what works. For instance, an area of real interest for us. Shocking that even though Yolo County is doing better than many shelters in California, still the return to owner rate for dogs is under 50% statewide. Less than half the dogs that come into California shelters with the express goal of getting back to their families are going back home. If we could figure out a way to crack the code, that would be a lot fewer animals to care for beyond their stray hold and find new homes for, or potentially have to euthanize. So, that's an area, for example, where we're seeking funding proposals and where Yolo County could certainly be competitive.
So, Doctor, has your organization sent out an invitation to communities to apply for these dollars and said what the deadline is and what information they would be expected to provide in an application?
The first call for proposals was a welcome grant that Yolo County Animal Services applied for and received. That was a $5,000 welcome grant. The second call for proposals actually went out 6 weeks ago and closes today. And we'll continue to have calls for grants as this program unfolds. As you may know, we've just launched this in February of this year.
Can I ask our staff if we've applied in that second phase?
I can answer that if that's okay. No, we are actually, we met with Kate and with Dr. Kraus, and that's where we're trying to figure out what the best, I guess, not use of the money, but if there was a way to develop a program or potentially a position. And so that's what we are working towards. So, and just trying to find something for, it would be a position, which would, the idea is, if I can just share that piece, is to have someone who is dedicated solely to the intake and the outcomes of the animals. We haven't come up with the creative name yet, but basically that is someone who would be working on, the pathways for animals and keeping them out as well. So we currently, that role is fulfilled by myself and staff, which and including Dr. Kraus and her team, and that there are other things that we should be focusing on. So if we could create a position for a person who can do that, and that's something that Dr. Hurley was talking about, model and see if that does work, then other shelters would benefit for that. So, that's what we've been talking about.
But if the deadline is today for this, is this something that we could apply for in a future, have a
Yes.
future opportunity for? Okay,
Yes.
Yes. So.
very good. Thank you for answering my questions.
I have a couple quick questions. Would large farm worker populations qualify as an underserved group?
Yeah, I do think that probably goes into the social vulnerability index. I don't have the criteria of it on the tip of my brain. But again, I want to emphasize that what we're looking at is the overall picture, the level of need in the community, the amount of euthanasia happening. So sort of like the desperation of the situation, the existence of partnerships, and the potential for sustainability of the proposals, right? This is a one-time investment. And so if there's no way to sustain a program beyond a grant that we might give, and there's no reason to believe that it would sort of prove a concept or result in some lasting change or improvement, then that's not the best use of the funds. So it is, we have a number of different criteria that we consider for the grant proposals.
Okay, and then differently, how might we connect with other departments regarding research collaboration?
I think that we've always had a good relationship with the directors at Yolo County. And so it's like, as things come to my attention that seem like a good fit for collaboration with Yolo County, I've brought that to Stephanie's attention, and Stacy has also played a role in facilitating some of those opportunities.
Okay, all right, thank you.
For
Other...
outside of the vet school, I think there might be some amazing opportunities for collaboration on marketing or engineering or management, public communications that I don't know about. So I think, UC Davis is a wonderful potential resource, but there has to be somebody with the time to sort of like get up above the fray and come up with those proposals and build those collaborative efforts.
Right.
And I think that's one of the reasons why we were talking about that sort of intake outcome position, to give Stephanie the opportunity to work with Dr. Krause to really think about like a little bit more of the 30,000 foot view, because shelters are so busy right now, and there is a need to like both be deep in it and just like dealing with what's coming every single day, especially at this time of year in the summer, which is the peak season for shelters. And at the same time, be able to plant some seeds so that things get better next year, instead of this just as hectic as it ever was and as many animals coming in as ever were.
Okay, thank you. If there isn't any other questions or hands up, we can move on.
Supervisor Provenza had his hand raised.
Okay.
Actually, I think Dan asked the question I was going to ask, and I believe the answer was sufficient. Thank you.
Very good.
And one thing I forgot to mention in the overview of the program is that we are involved with facility design, as some of you know. So we work with architect groups to consult on shelter facility design, housing use. So that's an area of expertise for us, and we've been involved in that way with Yolo over the years.
Okay, great.
I think that would be an opportune moment to move to Dr. Krause, if you could please present.
Yes, hello everyone. So I was going to introduce the team structure a little bit. I'm actually on site at Yolo County with a team. There's one full-time veterinarian, a part-time veterinarian, and then 4 what's UC Davis classifies as animal health technicians, or vet techs would be how they're probably what people are most used to referring them to. One of which is a licensed registered veterinary technician, and a supervisor to the other techs. So that's kind of our team structure. In terms of services and how it's paid for, Yolo County has a contract with KSMP at UC Davis and pays a portion of everyone's salaries, and then KSMP subsidizes the other portion. So that's a really nice partnership there, that it's a shared, paid positions. In addition to our team, we host senior veterinary students. So the 4th year students at the veterinary school that are completing their 4th year clinical rotation. And they provide a tremendous amount of support just in the number of bodies. They help with a lot of the duties that the shelter staff would perform, such as medicating animals, moving animals, helping with dams. So they're a huge help there. In addition, we're training. It's a unique program because we have the opportunity to train, the newly graduating veterinarians in shelter med. So I think everyone's aware of the current veterinary shortage with, estimated 7,000 openings across the country. So it's really important to us to train the next generation of veterinarians. And then the team also recruits, trains and manages interns that provide support to supplement the staffing and to support the surgery program. So it's kind of the structure and all the bodies that are present. And so we provide medicine services, surgery services, and then also population management. So that's pathway planning for all animals coming in, and then additional software support in the form of creating reports and running the shelter software. Does anybody have any questions about structure? Or I guess you want me to wait till the end on questions?
Sure.
Just might be, I don't want it to be too much information for people. So kind of areas we were directed to provide information on, how services and operations could be improved at the shelter, just to become more efficient and helpful to humans and animals. So, big area is adequate staffing. I think everybody that's worked everywhere agrees with adequate staffing, which most positions are filled, it looks like, Stephanie, maybe 1 or 2 vacancies, which is a great place for the shelter to be at. But not only adequate numbers of staffing, but also, our recommendation is not the total number of staff, but ensuring the staff that you do have is adequately trained and in the right position, performing the right functions for their job duties. Stephanie had mentioned there's a lot of people being pulled in different directions, just trying to get all of the work done. So, that's one area, is having people properly placed in the right positions. And then that brings us to the big, one of our goals with the grant funding is, helping to fund and support a mid-management support, position. So we haven't agreed on a name, but like a loosely operations manager is what shelters typically title that position. So somebody on site to train, manage, supervise the staff and everything that goes into all the daily care and things that the animals need daily to move through the system as quickly as possible. So somebody on the ground to oversee that, and then to help too with just maybe intake diversion and quicker outcomes. And that position right there would would considerably free up resources to free up vet staff to be able to, so we could be utilized to our fullest potential, definitely. So I can go, if anyone has questions at the end, just a little more details about that position, I can add to that for sure. Of course, we don't know exactly what it would look like, but we have a general idea of the duties for that person. So other kind of just big general topics of ways to improve efficiencies. We mentioned staffing is important, but it's also just less animals. So keeping animals out of the shelter, increasing those return to owner rates is huge, as Kate mentioned earlier, for all shelters, Yolo included. So, these animals, especially dogs, these animals have a home, they all come in great body condition for the most part. They look well fed. And so these guys have homes. So how can we get them back to their home, right? They're not true strays in the community typically. And then really only truly impounding animals that are sick and injured and that need sheltering or confiscate cases. So cases, animals that truly, need the help and don't have a home. Improving another just big general areas, improving and streamlining the adoption process to increase adoptions. Again, ways to have less animals in the facility, because some of these animals do need to be turned around, adopted out. We got a litter of puppies that, were surrendered. So those guys do need new homes. So if you just kind of look at the imbalance of numbers, I think there's 9 officers, technically. Stephanie can correct me. ASO, so 9 positions in the field that are picking up and bringing in animals daily. And then there's 1 position that's might be part-time that's responsible for getting animals out. So right there's a big imbalance in how many people can bring animals in versus how many people are there to assist to get animals back out. Big one here is establishing more and or enhancing existing relationships with existing rescue partners. So this is huge, right? Everybody can kind of play their part in the community. So, and I can go into more detail of that if anyone has questions with that. And then kind of some current challenges is just, again, coming back to the theme of the shelter just not having that mid-management level position. So that support there was a position, one of those ASOs, animal service officers, that did get promoted to a kennel supervisor, but when a staffing constraint comes up, she's pulled out into the field. And so they lose that on-site person. And the shelter feels, they feel the effects of that when she can't be utilized in the shelter. And then, so services that are appropriate for, animal services versus who, what we might want to partner with. So typically in communities, and this isn't really that large of a county relative to, say, LA County, and they have 5 shelters with large intake. So but in most communities there's the municipal organization, which Yolo County Animal Services is, and then they usually partner with a nonprofit to supplement the needs for the community. So the shelter historically is taking care of your sick and injured, foster animals, providing spay neuter for in-shelter animals so they can be adoptable, and just overall population health. And then what's helpful is a nonprofit, typically that will provide additional resources, right, as their staffing allows. So, a big one is spay neuter, which I'm glad to finally meet Amanda. Hello. It's like, oh, she exists. I just see her name everywhere, but I haven't actually met her. So, partnering with a group, Amanda Hartman's group, and it's been great. We've had a great collaboration when we're not full of kittens. In the slow season, we work very well with Amanda's group and say, hey, we have so many slots on the surgery schedule available. Would you like to, bring in some of your TNR, which is trap, neuter, release community cats, because we know community cats are a hot topic. So we're doing what we can to help that group by altering those animals. But she's great by doing all the organization. She knows where the cats are. She's working with the colony caretakers, and that's all really streamlined. So we can just focus on just performing the surgery and releasing those cats back out. I think that's about it. Kind of a big overview. Does anybody have any questions?
Okay, great. Thank you very much. Couple of quick questions. Can you share with us what the spay neuter numbers currently are?
Yeah. Just all numbers. Any specifics? Just general, like what's the?
Yeah, just how many we're
baseline
managing to take care of every month, like on a monthly basis.
So typically about 1,500 to 1,600 a year. Spay neuter surgeries, and in addition to spay neuter, when resources allow, and it's an adoptable candidate, we also perform special, they're just referred to as special surgeries. So that would be injured animals that need a tail amputation, a limb amputation, having an eye removed, a mass removed. So anything in addition to just spay neuter.
Okay. Do you have any ideas how we might increase the spay neuter opportunities in the local communities?
Yeah, so that's what I was saying. So the shelter can, about how it's staffed and the current staffing and management, can meet the needs of the incoming animals that need to be altered before. It's not just adoptable animals, it's also animals that go to rescue. When a person redeems an animal that's intact, the shelter works with them to lower, fees to encourage them to spay and neuter. So we're doing owned animals in that sense as well and sending them back to the community. So again, that's where partnering with a nonprofit that can solely focus on spay and neuter efforts. I've worked in high volume clinics. I'm capable of doing 30, 40 a day, but we're limited by the shelter is limited by the facility. There's only 13 kennels to recover animals. So that's kind of just our capacity, daily capacity. So and then in addition to surgery, right, it's medicine and population management and all those other items I mentioned that we're responsible for. So partnering with a group that can solely do spay neuter is how you can increase numbers to actually make a dent potentially in the cat community.
So are we currently pretty much at capacity all the time?
You mean shelter population?
Well, for the spay and neuter and
Yes.
where we at, we're pretty much maxed out unless we have more space.
Correct. Yes.
Okay. Is there any other questions?
I don't know if anybody has, the structure, if anyone has been on site to the shelter, surgery takes place in the back of a tractor trailer that was designed initially for feral cats to only accommodate just 10-pound patients. And the shelter impounds, 100-pound German Shepherd dogs. So it had to be retrofitted you can't fit a Shepherd on a small cat table. So, we're limited. We have like one large table to prep a large dog, right? And then one table for cats, where it used to be multiple tables just for cats. So if you're doing just cats, you can do a lot more surgeries. It's kind of the pounds per animal per day that you can do, right? So, and it's only as wide as it's narrower than a car lane because it's a truck trailer. So it's very limited in its space.
Okay.
But we do the best we can with what we've got. We've remodeled it several times to make it more useful.
Okay. Anybody else with questions?
I do.
Go ahead, Dan.
Sure. Really just one. And I appreciate you touched on a lot of areas and our time is limited and I want to be mindful of that. But help me think about the scope of services that this as a governmental organization should be doing versus what things are best left for, let's say, nonprofit partners. Obviously, we have a duty to take care of those animals that we have in custody. And it sounds like strategies like spay neuter that could impact the number of animals that we take care of sounds like a very important thing to have and keep within our scope. There have been suggestions about our going out in the community and trying to offer animal services for people who are poor and would struggle with veterinary care. But is that something you think that is possible for us to do, or is that the kind of thing that probably we would rely more on our nonprofit partners to do?
Yeah, probably more the nonprofits. I'm just thinking, what are the kind of overall goals and objectives, right? You have to, to really get to a solution, right, you need to identify the problem. So is the problem that too many animals are coming in? Why are they coming in? So what is the main reason for impound? It's not historically 10 years ago, plus it was litters of puppies, boxes after boxes of puppies, right? And then as spay neuter efforts really ramped up nationwide, and there was funding for that, now we no longer see litters of puppies coming in by the box full. So spay neuter is not currently the solution to decreasing the number of animals in, say Yolo County. It's all adult dogs, 2-year-old adult dogs. Because, if someone wants to get a pet, they're going to get a pet. So they acquire the pet, comes into the facility. We really need to assess the reason why. And really, there's not too many medical mean, most animals are stray. There's not too many medical owner surrenders, you know, animals that are surrendered because they need care. We're pretty lucky that we're not as impacted as other shelters with that. And there are resources, you know, Sacramento, the Mercer Clinic for the pets of the homeless. I know that's a different county, but West Sac is just right there, you know, and I think that a lot of those animals are, you know, there are a lot of opportunities actually in this area. There's the Knight's Landing Clinic. So organizations, and those are actually run through UC Davis, you know, organizations that are providing that level of support, which is probably why we're not seeing a large number of intakes for that reason. Mm-hmm.
Thank you.
If I could just add to that, I think, as Dr. Kraus said, you know, Sacramento has the benefit of having the Sacramento SPCA as a private partner that has a large facility and really robust resources, although they also still have a waiting list for spay neuter right now. I think as communities get smaller, partnerships, like really functional partnerships, become more important. So there can be support between private partners and Yolo County Animal Services in terms of providing a space, providing transport, providing messaging, providing the surgery itself. Encourage everybody to think about those possibilities. You know, the bigger you are, the more it's possible to really divide everything up. The smaller you are, the more important it is to work together and leverage every possible contribution.
Supervisor Provenza?
Thank you. Dr. Kraus, could you kind of give me an estimate of how many hours you're at the shelter providing services per week? Or month, whatever measure you use?
Yeah, the whole team.
Yeah, you and
Yeah.
the team, yes.
Yeah, so we're so there's one full-time or FTE equivalent, you know, veterinarian, and then a part-time. So about 50%. She just renewed her contract at 50% time. And then the 4 animal health technicians are all full-time.
So it's 4 techs at full-time and 1 vet at half-time.
1.5 veterinarians.
Oh,
correct.
1.5. Okay.
Yeah, 1.5. Mm-hmm, mm-hmm.
Okay.
Which is appropriate staffing for this, you know, the shelter's intake numbers.
Okay. And both you and Kate had Dr. Hurley had mentioned the need for someone to focus on return to home. So were you referring to a need for a new position?
Yes. Or, you know, it depends. The staffing levels are very dynamic, as Stephanie can, you know, attest to. So like this is the first time where there's probably been this much staff since I started working there in 2016. So, you know, there's also systems that could be put in place in the interim, you know, to this position.
I think also there's a lot more that goes into getting dogs home than even a single position. So I would say that's probably in some ways 2 separate things. That position, something that we have recommended, other consultants have recommended over the years. But also we're recognizing that fees can be a big barrier to getting animals back. And we can end up, you know, sort of holding out for a fee, and then the animal doesn't get reclaimed as a result. That person goes buys a puppy from their next door neighbor that's intact and unidentified and unvaccinated. So we didn't make there be one less dog in the community. And now the shelter has the problem of trying to find a different outcome for that animal where there's no cost recovery with rescue and adoption or euthanasia. And so just like addressing fees, or, you know, mention that there's a bunch of people out on the road picking up dogs, but do they have the time and the directive and the training to spend time when there is a dog called in to say, like, here's, you know, what we're finding is that the majority of dogs are found within 700 feet of home. So you can imagine if a dog, I live in West Sac, if a dog gets out of its yard, it's 700 feet from its yard, it ends up in woodland, especially if that owner doesn't speak English, doesn't have a car, you know, just like it doesn't have the wherewithal readily to get all the way across the causeway, might not even know that that's something that could happen. That dog's never getting back home. So if an officer had the time to like go hang door tags, like put up some signs in the neighborhood, knock on a few doors, or if someone on the phone could respond to people who are calling saying, hey, I found a stray dog. If you could have an interactive process on your website so people could upload the dogs to Lost and Found so they could get back with their owners even before they come into the shelter, that could potentially really increase the number of dogs getting back home and drop the number coming in. And that's the kind of thing where like, there's lots of different pieces that need to all come together. That might be, each one might be necessary, but not alone sufficient. Like we could waive fees, but maybe nobody would know that. There's so much oral tradition that it costs a lot to get your dog back that people just don't go. They don't even look. Or maybe we could waive fees and put it out there, but not in the right language. Or maybe we could waive fees and put it out there, but the problem is people don't have cars. So there has to be a lot of different things that come together, I think, to solve that problem. But once we crack that nut, I think it will really be transformative.
Thank you. And then you mentioned, I think one of you mentioned a mid-management person. Is that a separate position in addition to the person to handle return to home? Or is that the same person?
It could be the same person. Yeah. They would facilitate so that, that person's would be involved with the pathway planning for the animal. So part of that, if it's appropriate to try to return that animal to owner, then that would be that position. Yeah.
Okay. Oh, one other thing, getting back to the 1.5 full-time vets and the 4 full-time techs, are they at the shelter full-time? 1.5 and the 4, are they always at the shelter?
Yeah, at the shelter with the exception of UC Davis observed holidays, which is different than maybe the county, a few holidays, and vacation and whatnot. Mm-hmm.
And Stacy, did you already provide the breakdown? I'm sorry, I was chasing after my foster dog for a second at the beginning. Did you provide the breakdown of what we provide in terms of we subsidize those positions?
Yes, I mean, I didn't get the breakdown of how it was subsidized. If anybody's interested in that. So KSMP pays for about 50% of my salary and about 75% of the part-time veterinarian. And then they pay essentially the county pays 75% of the technicians and KSMP pays for 25%, or that comes out to the county pays for 3 positions and KSMP pays for 1 of those tech positions. Mm-hmm.
And so those are 1.5 vets at the shelter full-time or 50% time.
Mm-hmm.
I was just a little confused as to whether they're at the shelter full-time.
Oh, at the shelter. No. So part of especially my duties with operating and running as chief of service of the senior clinical rotation, I have obligation, I work for UC Davis and I work at the county. So there's a certain amount of time and duties where I have to attend to Davis related duties. Mm-hmm. Okay.
So do we know what percent of time both you and then the other veterinarian spend actually at the shelter?
I don't know. we haven't been tracking that specific time. Yeah.
It'd be good to see at some point when you can get that to us so we can kind of better assess our staffing. Okay. And then the technicians, are those all positions all the time at the shelter, or is that the same thing that they're somewhere else?
The technicians are mostly, there's some work from home time. Yeah.
Okay. All right. Well, yeah, it would be helpful to get that information.
Yeah.
And one other question I had.
The part-time veterinarian does not have access to Chameleon, the shelter software at home. But that was one of the things during the pandemic with so much remote work that I acquired so I can remote in to Chameleon software because a large portion of what we do is in the computer to plan the day, plan the surgery list, create the daily to-do list. So, there is remote work for the shelter on my part, not the other veterinarian's part.
Okay.
Mm-hmm.
Thank
and
you.
I'll add that the funding that we provide is just, we've been fortunate to be able to get grants and donations. So like the rest of our funding, it's separate from the state funds. we've been providing that for over 10 years now through a series of grants that we've been able to get. And definitely Yolo County is getting more than you're paying for in terms of veterinary services. So although Stacy does have some duties at UC Davis, there's more time being spent at Yolo than the FTEs that Yolo County is paying for. We don't have a guarantee that we'll be able to continue doing that forever, but we're hustling as hard as we can to be able to continue to provide that. The students get a lot of value out of it. We appreciate the partnership.
Does Yolo County need to be doing more in terms of seeking grants at this point?
I think that to seek grants for expanding spay neuter services.
Oh, that or
yeah.
anything else? Okay.
And
I mean, in terms of being a partner, especially in terms of being a partner, and because I want to hear from Kim Kinney and the other folks who are part of this puzzle. Certainly grants, so many grants are most competitive if they show partnerships.
Right.
That said, I think Yolo County has always been a standout in terms of getting grant and donor funding, where a lot of public organizations have had a lot of difficulty asking for and processing donor funding. My experience, White House has been pretty successful in that regard.
Thank you.
Stephanie, did you have something that you wanted to add?
Just really quickly, I'm jotting down some notes and I want to be able to address some of the questions that I think that are more specific to, that I can help answer some of those processes. So I will put those together and give those to Joanne, so that way we can share those just with the JPA members, because there are just some specific things that that you're bringing up, and I would like to address those, and also the programs that we already and the processes we already do as well. So that'll help you see where we can improve on that. So that was it.
And I would just say that would be a fit subject for a future meeting to have those interactions. I mean, I'd love to hear our staff, and of course there's various staffs here, their feedback on what they heard, what ideas does this discussion provoke. I think would be useful to engage in that discussion at some point.
And I hate to move us along when I know we could linger with any one of these, but I want to make sure we move on to Kim Kinney from Yolo SPCA. Kim, if you could take it away, please.
Thank you. Good afternoon. Thank you for having me, and glad to see things moving forward on talking about animal welfare and the possibility of a new shelter in Yolo County. Just want to talk a little bit about the Yolo County SPCA. We've been around for close to 50 years. We are a private nonprofit. Our focus obviously is to help animals in need in our community. Through the years, we've done a number of different things. We actually, years ago, did operate a small spay-neuter clinic in Woodland, but back then just couldn't quite get it off the ground. For close to 20 years, from probably about 1998 to 2018, we did have an MOU with Yolo County Animal Services, where we did provide several services, including managing the Lost and Found program, managing all the rescue of any of the animals, mostly cats and dogs, but we did help out with various chickens and rabbits over the years. We also helped create a couple of the programs that are ongoing, one of them being the TNR Community Cat Program. We did help implement and start that program. We also did bring I hate hearing it, but at the inferior Big Fix rig, we were helpful and instrumental in getting that here from Florida, along with Kate Hurley. And we also did contribute financially to the original retrofit once it did arrive, about $25,000 if memory serves me. And then we also did help create and implement the volunteer coordinator position. For many years, Yolo County Animal Services did not have a volunteer coordinator, and it was one of the things that we kept stressing that they needed and that we all needed, including our staff that was there at the time. So in 2009, after a lot of research, helped create the job description, and actually helped fund 50% of a part-time volunteer coordinator position, I think for probably the first 2 years, if memory serves me. We did leave in 2018 for a variety of reasons, but I have met with Stephanie over the years, and she and I have talked about some outreach programs. Pandemic, of course, has made that a little bit difficult for both our agencies, but we're here. We're still rescuing as many animals as we can, and taking in as many cats and dogs as we can from Yolo County. I will say we do rescue from other shelters as well, as the opportunity arises. One of the other programs that we have had for almost 20 years, I believe it started in 2002. We originally partnered with Animal Outreach out of Diamond Springs, and then the name of the clinic in Auburn escapes me at the moment. But for 20 years, we have transported cats in Yolo County up to these various clinics. Now it's the Sacramento SPCA, and we've been doing it exclusively with them for probably 10 years now, maybe 12. Twice a month, we load up our van and we drive cats up to these clinics to offer spay and neuter services for cats. The concept behind that was because cats were such a huge impact to the shelter population, and the outcome for cats was not good. And so we thought, well, let's get them spayed and neutered and do as much as we can. This does not extend to TNR, unfortunately. It is simply friendly cats, but we do serve all the communities in Yolo County. We have people who live up in Gwenda or in Clarksburg or in West Sacramento. They meet us either at Sacramento SPCA directly, or they meet us at our thrift store or Tractor Supply in Woodland. And so we average about 25 cats per transport. Sometimes we've had to use those slots for our own foster animals because spay neuter services are such a challenge. But as much as possible, we try and offer most of those slots to cats in our community. There was talk prior to the pandemic of extending this to dogs, and my contact at the Sacramento SPCA still would like to do this, as would I, because again, I think you've heard from everybody, spay and neuter is a priority. It's needed, and I think ultimately it does help keep animals out of the shelter, and that is definitely one of the things that does need to continue happening. So unfortunately, the pandemic again has slowed down a few things. But again, we're hoping to revisit that, especially for dogs. It'd probably be small dogs like Chihuahuas and Terriers. I don't see us transporting the German Shepherds or larger dogs, which is probably just as needed. But we're hoping to create that program here in the near future. So that's pretty much, we're getting close to 3 o'clock, so I also didn't want to take up the whole 5 to 8 minutes, but I think in a nutshell, that gives you an overview of the Yolo County SPCA. Anybody have any questions or comments or?
Supervisor Provenza, did you have a question?
I'm sorry, I didn't lower my hand. No, I don't.
Oh,
Mr. Carson?
I do. So I'm going to ask a question, and I want to make it very clear that I've not reached any conclusions on the matter. This is about exploring ideas. So from some of the consultant reports that I digested back when I took this as an assignment less than a year ago, some animal control departments are structured with a different balance between officers and either civilian or nonprofits running the show. I'd be interested in your opinion on whether you think there's room for us to explore alternative models here, or is the size and the nature of Yolo County such that putting the sheriff's department in charge here is what makes sense?
well, again, I've served on a number of committees and commissions and been to a ton of meetings, probably for almost 15 years, discussing that exact question. I do think it's worth exploring, but again, I think unfortunately a lot of people assume that having a nonprofit do a portion of running a shelter is free or is going to save a ton of money, and that was kind of the expectation going back to, I think, the 2010 talks and then even the 2013 LAFCO report. We were asked to put forth a proposal. We actually did entertain it, and I actually did have several discussions with the Solano SPCA because they actually had a history of providing field services for the Benicia shelter. And we were actually going to put together a proposal, but at the end of the day, unfortunately, we had a lot of concerns with the RFP that was put forward, asked a lot of questions, and unfortunately, they just weren't answered. So neither of us felt comfortable at that time to be able to put forth a proposal. So I think, again, when 2017 came around and the talk of the JPA came up, and then we started looking at all the different models, again, there's an expectation that a nonprofit's going to save all this money, which, you know, is a lot of what the city's looking at. But, you know, you have to remember that a nonprofit's still going to have to charge something in order to protect its entity and be able to provide the services. Having said that, I have no experience running a shelter. I have no experience running animal services. But, you know, I do have business experience, and I do think it is a good model to explore. I think we did have a very good partnership for a number of years, and we were able to offer a lot of good services. But at the end of the day, you know, we were just a guest there, and had some say and had some input, but it was not our agency. So I think that answers your question. I do think it's worth exploring.
I think it does, but is there a department out there in California for a community of our magnitude and size? You know, LA, comparisons to San Francisco and LA are worthless to us, but
Right.
Is there somebody like us out there that's doing it differently?
You know, honestly, I don't know. I think that's probably a better question for Dr. Hurley. She would probably have more, especially with this grant. She's probably going to see a lot more of those collaborations and those partnerships. I know Nevada Humane was one that a lot of people looked at years ago, but I'll be honest, I don't know if that's still their structure. I think at one point Santa Cruz might have had a similar structure, but I could be mistaken. And again, I don't know their population in relation to our population. So again, I think that's a really good question for Dr. Hurley. It's a little above my ability to adequately answer.
Thank you.
I can speak to that if you'd like. Or I can discuss governance at another time and in greater depth also. There's a number of communities of various sizes in California where a private organization holds the animal services contract. Marin Humane, Pasadena Humane, San Gabriel Valley Humane. So there's quite a number of models out there where a private shelter holds the contract for counties that are probably not dissimilar to Yolo County. It really comes down to whether, you know, as Kim said, whether there's an organization who is interested and capable of taking it on, and whether that ends up making more sense, both operationally and fiscally, than having it operating under a city or a county.
Would Marin be a good field trip for us?
Let me think about what would be a good field trip, because Marin's is a very well-established shelter. So they've had a humane society that's over 100 years old. And so, you know, potentially a better field trip would be Fresno Humane that just recently took over from Fresno City and County, even though it's a much bigger operation. Just in terms of moving services, that would be an interesting one. And I can think on other ones that are more like on the scale of Yolo County, and the same kind of mix of a lot of rural areas and some little towns.
Thank you.
Just had a brief comment. Dan, thanks for that question. It was a really good one. But I also think, I know when we formed the JPA, there was part of the thinking was, well, we can examine other governance models, and there may be other governance models out there, or maybe one that no one's thought of. We thought of the JPA essentially as possibly moving into the role of governments with some structure underneath it, which could be some combination of public-private, or it could be public but not under the sheriff's department. There's a lot of possibilities. I recall for a long time, child support collection was under district attorneys. People weren't happy with that, and so it was removed and put under separate county agencies, and people were much more happy with that structure, because it really animal, the part of animal control about picking up an animal's threatening is still within the domain of law enforcement, but the whole shelter system really is not in the sheriff's bailiwick. So we can, I think, in the future, think creatively about what governance model might be best for us.
It's definitely something that, I mean, I was a co-author on the LAFCO report in 2013. It's an area of a lot of interest. I will say a couple of general observations. It's best for field services and sheltering to be under the same umbrella rather than split. Otherwise, it's kind of like the right hand and the left hand are not in communication. That can be really dysfunctional. And it's keeping up with sheltering, especially these days, is really a full-time job. So it's important to have a director that is accountable, but also reasonably empowered so that they're not beholden to 7 different entities or individuals, whether that's a board of directors or a JPA or a board of supervisors, where they're trying to not only keep up with policies and processes, but also then communicate it to people who it's not their full-time job, and you can't be expected to know the ins and outs. So directors under whatever model do need to be, it's like they need to be good, and then they need to be allowed to sort of make some decisions.
Right. You need a strong executive director or whatever you would want to call the position. I agree.
Yeah.
And I would say, Stephanie, feel free to put this on your list for feedback too.
I've always felt that the only way this is going to happen for Yolo County is with a strong private public partnership. So I think some form of that is what needs to be looked at. I've heard that El Dorado Diamond Springs has a pretty unique model. Dr. Hurley, are you aware of their model?
I'm aware of Grass Valley. Last I know, El Dorado County Animal Services was kind of a straight up county organization. So I'd have to know the details if that's like a particular city within El Dorado County that's got a different setup. But anyway, like I said, this is an area of interest for me. I'm happy to take time to look at models that you think are interesting, provide feedback. We learned a lot doing that LAFCO study. That was very eye-opening for me, and it's something that I could continue to be interested in.
I would find that of great value, and I am open to doing a official site visit as part of this JPA if folks are interested. If they don't have the time, I'm happy to go with maybe 1 or 2 others if they have the time.
Lisa Gaines has some knowledge about the El Dorado Diamond Springs, and she said she'll reach out to you, Dr. Hurley.
Good. You know where to find me.
Anybody else with questions? Okay.
I'm hoping now we can go to Yolo County Spay and Neuter. Thank you so much for joining us. I'm sorry our time is not as long as we might need for all of the partners to speak today, but Amanda Hartman and John, if you don't mind jumping in at this point.
Perfect. Okay, so my name is Amanda Hartman, and I am the president of Yolo County Spay and Neuter Group. We've been an official nonprofit since 2018, and our main focus is spay and neuter. We just recently acquired a 37-foot mobile spay and neuter van, and it can accommodate 30 to 60 animals a day, depending on the vet, which is a miracle for Yolo County. And my main goal is to be able to partner with Yolo County Animal Services. We have an excellent relationship with Yolo County Animal Services. And we currently, just like the SPCA, we are running tame clinics weekly, cats, and we also run community dogs. And with us, we can actually go into those rural areas, unlike Yolo County Animal Services. I bring along a Spanish-speaking friend of mine, and we go and talk to the people in those little rural areas, Cape Hay, Madison, Esparto, Clarksburg, Knights Landing. And we help these people get their animals spayed and neutered, because like everybody says, at the end of the day, it all comes down to spay and neuter. And we can do that. We are hoping to be open with our mobile rig in the next 2 months. And we can definitely accommodate those feral cats, people's dogs, and people's owned cats as well. And also, sorry, we are currently running multiple cats a week, and we also take advantage of our partnership with Sacramento SPCA. We have been partnering with them as well for over 10 years. John Ramming and I together have probably TNR'd feral cats alone, probably at least 8,000 feral cats. And our numbers for 2021 for feral cats and owned cats, we altered 1,011 cats. And for dogs, which includes our rescue dogs, we fixed 204. And we also pool those medical cases from the shelter or various shelters around California as well. And we do the community outreach. And I honestly believe that the community outreach is key to knocking down this problem. We have so many people here that are just unaware of any services for their animals. And I have found that going and talking to people in Dunnigan, everywhere, they just don't know about it. Or, you know, a lot of them don't care. And when we're able to tell them and present reasons why, then they're ready to get on it and they'll let us come in and help. And we also operate on our own dime. We operate strictly on donations. We have applied for grants and we've received them. We did receive part of the mini grants. Thank you very much. And, you know, it's all on us. We don't ask for money from the county to do this. And we don't have a time period. We're not a 9 to 5. We can go out in those after hours and scan the animals, make the phone calls, and reunite pets with their owners. I don't know if John's on here, if he wants to jump into on what he does as well, but there's 5 of us total on the organization. There's myself, who's president, and I'm the main TNR coordinator for feral cats. We have an adoption coordinator. We have a foster coordinator. As we take our animals, we're not a kennel facility, so everybody's in a home that we have. And this is something we do on our own, separate from Yolo County Animal Services.
Yeah, I'll just add to what Amanda said that, again, we're some quasi-retired individuals doing this on a volunteer basis because we've identified with wanting to solve the problem. And that we felt was the best way to do it. We find that we can open a lot more doors walking in as volunteers, offering to help people without requiring a substantial payment to start with. So right now we're running about 50 animals a month into SAC SPCA. We used to run closer to 100, but those days are gone. Their capacity filled up and out of county had to be pushed out for reasons. So with our own rig, we're hoping to bring some capacity into the county, and it'll take a while to bring that rig up to speed.
Supervisor Provenza, did you have a quick question?
Yes, yeah, thank you for the work you're doing. It's tremendous. I wanted to ask you, you had mentioned that you would like to partner with Yolo Animal Services. Is there any impediment to that? Is anything that we can do to help?
What we need is ground, pretty much. We don't need any funds. We just need somewhere to park our rig and the trailers that go with it, because by law, we do have to have a trailer considered a break room for our employees, which we will have a vet, maybe 2 vets and a RVT, maybe 2 if the vet would like a second RVT, and then a number of volunteers. So basically that's what we need. We will do all the financial part of operating this rig.
Great, that sounds fantastic. And Stephanie, is that something that we can work with Amanda on?
Absolutely. That's what I have been really hoping at a later date, but that we can discuss the vision of expanding next door from the shelter to the probation trailers. That parking lot is phenomenal, and that's something that I do see as a vision that would be a perfect place for a spay, neuter, and adoption center. Because we are making the improvements here right now, but that is somewhere that trailer could go, and the access would be perfect for people dropping off and picking up. So that is something that definitely we've been talking about.
Well, it sounds like a great idea. So you're bringing that back to us at a later meeting?
Absolutely.
Fantastic. Thank you.
And I hate to pause the flow of conversation, but we should take some public comment now.
Okay, sure thing.
Is there any member of the public that would like to make a comment at this point?
I do show Eileen Sametz.
Can you hear me now? Okay, thank you for this excellent meeting and presentations. So I've worked with Mercer Clinic for 28 years. I've worked with Yolo County SPCA for a number of years now. And what I have seen, which is desperately needed, is the county, Yolo County Animal Shelter. We need a larger and much improved animal shelter. It needs more staffing. It needs more help from even the veterinary support it's getting from UCD now. I mean, for the amount of number of animals it has to service. Particularly what we've noticed is that, because the spay and neuter, low-cost spay and neutering has been eliminated for the public. It's only in-house spaying and neutering that's being done. That's resulting with pet population overpopulation. And since I work with trap neuter release groups as well, we need to get that restored of neutering of feral cats at the county shelter, which used to be available even on a limited basis, but we need far more staffing. We need far more help, including from university sources. Apparently, since we have a veterinarian or one and a half veterinarians on site, they need to be there, full time and as much as they can be. But also we need a new shelter. And this has been something that's been needed for many years and been advocated for, but has been kicked to the curb, way too often. So now is the time to be moving forward with, because Yolo County has grown, the need for services from the Yolo County Animal Shelter, which has not gotten the attention and the staffing and the funding that's needed for years, needs to be addressed, and it needs to be addressed now. Thank you.
Thank you. Anybody else?
Yes, I have Sally Ozanoff.
Hi, thank you very much for allowing me to ask a question. I have a question for Dr. Hurley or Dr. Kraus. You mentioned that there has been improved cat housing at the Yolo County shelter that you participated in. And I'm also wondering what your professional opinion would be about the need for improved dog housing at that shelter. And if you could perhaps describe for the JPA members what the current dog housing is like and what it should be like, and what the implications are for the need for a new shelter. Thank you.
Should I answer that? I'm happy to answer that.
Please.
Yeah, there is a desperate need for improved dog housing at the shelter. The housing right now is in poor repair. There's some safety issues. It's really impossible to truly sanitize. And most importantly, it's just a single compartment. So the dog doesn't have any place, dogs have a strong drive to poop and pee away from their food and bed. That's really important to maintain housebreaking. That's not possible. And most importantly, the dog needs to be removed from the run every single day. Moved somewhere else with all the attendant safety and disease exposure risks, the kennel cleaned and dried or left wet, again with safety and health risks associated with it, the dog replaced in the kennel, just like a very time consuming, very fraught with risk. And can go to a lot of shelters in the region and see what we recommend, which is double compartment runs, so that there's an area for the food, water, and bed. Then there's a little door that can open and close, and on the other side is where the dog goes potty. And then the staff can move the dogs all to one side, close those doors, go through, spray and disinfect all the runs, dry them out, open the doors, move the dogs from the other side. So an enormous ongoing staff time saving, dog health improvement, dog behavior improvement, whether that's through a new facility or even just retrofitting and really investing in appropriate housing on the footprint of the current facility is something we'd be happy to work with you on.
Thank you. Anybody else?
I don't see any additional hands raised, Chair.
Okay, thank you.
Wait, I do, sorry, we got one more. Just as I said that, looks like Lori Lubin.
Okay, welcome, Lori.
Hi, thank you. So I'm Professor Lubin, and I've been part of a group that has been working to get a new sheltering and a new shelter model in Yolo County for more than a decade. So I'm happy to see many old faces here. So I think I want to use my time just to encourage you after 10 years and to really, we're very happy that there is finally a JPA and there's a body that's now going to look at the sheltering model, which we've already discussed today, but also the need for new facilities, whether it's retrofitted or a new building. So I really encourage you to take this opportunity to finally make some significant progress in improving the model of sheltering in Yolo County. Thank you.
Thank you. Okay, anybody have any closing comments or thoughts?
And we have about 8 minutes left in our scheduled time. So additional questions, even if we don't have time to answer them all online, we can distribute answers to folks afterwards. And any direction you have for staff for future meetings.
Okay, anybody?
So Wade, this is Dan.
Yes.
Just two comments. One, I'm glad that Stephanie indicated that she's kind of collecting areas where questions or issues came up that she would like to respond to. I would invite all of county staff who feels that they wish to weigh in on any of those issues at a future meeting to do so. And then just to go back, that I am open to the concept of a field trip at some point. Maybe it's after summer, but and I very much appreciate our UCD partners willing to help target us at what's a place or two at the very least that would be a great site to visit, that would give us, I'd say, an array of options and alternatives for a structure for these services. Not necessarily just a civilian operation, not necessarily just a nonprofit operation, but what do you think we could most learn from? I would find helpful.
Thank you. Yeah, I'd like to also see us kind of push to the forefront, because it seems like a low-hanging fruit, moving in the direction of how can we work together with Amanda and her team with the mobile unit sooner rather than later, because that sounds like something that's could be a tremendous help with the amount of spay and neuter that we're capable of doing. And it seems like something that to me is a low-hanging fruit. So the sooner we move forward with a partnership with their team, I think the better.
I agree with Wade on that, and all they need is a parking space. So it seems very doable compared to some of the other needs, and it would do a lot of good. I would also like to look, because the resources are a little bit confusing to me, perhaps to others, as to how many actual vet hours and technician hours do we get at the shelter from our agreement with UC Davis, because that's going to be important at looking at the overall staffing levels and the challenges on staffing. And then in terms of any new positions, what the costs might be, and how we might seek to cover that if we were to go in that direction. And then, of course, Underlying all of this, I think we have to keep in mind the need for a new shelter, and we can be doing both of these things simultaneously.
And Wade, if I may, I concur with what the supervisor just said. And there is this interactivity between the two things, as we've talked about before. If there are things we can do, like spaying and neutering cats to reduce the populations that come to the shelter, that helps you right size the improved shelter and helps you better understand what facility improvements you actually need. The other thing is that to the extent we can make this a more efficient and more effective operation, it might clear out space within the existing fee rates that our various jurisdictions are contributing to help operate a new and improved shelter. So I think these pieces all fit together. And I'm glad to see these conversations occurring.
Yes, I agree.
And I do like your idea of looking at other models. We maybe need a little bit of research on what would be the closest and best models for us to look at. But that always educates and informs, and I'm always willing to take some time to do that.
When I had the prison assignment for LAO, I was in and out of 22 prisons. You know, I could say at cocktail parties, I've been in and out of more prisons than anyone you know. So,
but for official reasons, not for any other reason, just to clarify.
20 arrests, no convictions.
So far as we know.
Stephanie, did you want to add something?
Real quickly, first of all, I just wanted to thank all of our partners for coming today. That is, I know it's a huge piece and a huge chunk of your time, but I do absolutely appreciate every one of you and also all of the JPA members as well. I have a lot to work on here, but just wanted to let you know that Joanne and I are working on putting together those few other models. So I've been contacting colleagues in the area who, so the different models. So that's the next step that you all are already going to be getting. So I'm glad that you want to do those those things because you're gonna get it. And then also looking at, I do have some very recent quotes and different things for renovating those dog kennels that did come up. So that's a quicker piece that we can do while we are still determining the actual building. So that is all information that I'm happy to share and willing to share and ready to. So just appreciate everyone's time and looking forward to continuing to move forward.
Thank you.
Yep. And thank you, everybody, all the panelists for participating today and giving us all a bit of an education on the topic. It was very informative, very helpful. And I look forward to moving some of these items forward as quickly as we can. Thank you, everybody.
Chair, I'm sorry.
Thank
And
you.
if we want to take our last 2 minutes,
Yes.
we've got one more public comment from Lisa Gaines.
Sure. Go ahead. Welcome, Lisa.
Thank you again. I just want everyone, although spay neuter is incredibly important, I want everybody to remember what Dr. Hurley said early on, and that's about related to education and the people's lack of understanding of how to get into the system of what's available to them, because that's the educational piece. And ultimately, that's what is going to decrease our intake and also working collaboratively for ways to increase revenue. So facial identification, there's quite a few other programs that don't involve microchips, but it's how do we identify animals and get them home? And I don't want you to lose sight of that piece of it as you get excited about spay neuter. Spay neuter is incredibly important, but education and all of the things that Dr. Hurley talked about early on are equally important. So they're just not as tangible. So just keep that at the top of your head. Thank you. Thanks everybody for what you shared. I know that I'm a pest and I push you guys, but we really do appreciate it.
Thank you, Lisa. Appreciate your input.
And that brings us exactly to 3:30.
Okay. Thank you, everybody.
Thank you so much.
Have a good day.
Wayne
Okay.
runs a tight
you.
ship, right to the minute. Have a good afternoon.
Great
Hey,
job,
this
Wayne.
isn't Davis.
I agree.